Welcome back to my channel, guys. My name is Dr. Oshilunga Oyindamola, and today we're going to be talking about coronavirus. For coronavirus has been in existence since 2019, hence the name COVID-19, which comes from corona, the first two words corona, virus VI, that's virus, then disease D, then 2018 because it was first it was discovered in December 2019, so that's why it's called COVID-19. Now, coronaviruses is a group of family that causes diseases in animals. However, there have been about 7 of them that are known to have caused that now cause diseases in humans. If you can remember the SARS, severe acute respiratory syndrome, and the MERS, Middle East respiratory syndrome, that was found in the early 2000s. Now the COVID-19 and some other ones. So initially, coronaviruses always affect the animal family, but now we have about 7 of them that affect the human. How can you get coronavirus? Coronavirus can be gotten from respiratory droplets and contact. Now, see, I did not say airborne diseases, and the reason is because I want it to be clarified. Respiratory droplets means that, okay, someone coughs, someone sneezes that has the virus, and then you get it, because when the person sneezes, it can travel as much as 3 meters and then you get it, or the person coughs and then the saliva gets through to the next person. Now, I want you to understand that most of these particles that come out, the large particles cannot stay in the air, but the smaller particles can stay in the air up to 3 hours. So it's said that if you are in a confined environment, for example in a house, and someone comes in there, hence the reason why they don't want gatherings, and someone comes in there, sneezes, and there are smaller particles, they can remain in there for about 3 hours, and someone else comes in there and those particles, you can actually have the virus. Someone who sneezes and it touches surfaces, and those surfaces are not clean, they're not wiped and all that, and you touch those things and touch your face through your mucous membrane can get into you and you can get the virus. That is the reason why we are advocating wash your hands. If you wash your hands frequently, you're going to kill about 98% of the germs, so you're going to eliminate. Also, if you use a sanitizer with at least 70% of alcohol, you eliminate a good number of the viruses and other germs. So hence, even if you touch your face, you have very low possibility or probably no possibility of getting the virus. Hence the reason for advocating of washing your hands and using the hand sanitizer. Then the use of mask. Please, the use of masks are for those that are sick. So if you have maybe respiratory symptoms and you don't want to infect the next person, then you use the mask. I need to use to use the surgical mask because it is reducing the amount that is available for health workers. And the health workers will need the mask for a lot of things, to be able to attend to patients, to be able to, even during theater rounds, we use those surgical masks. So the more you purchase them, buy them in bulk, it reduces the availability for the health practitioner. And we are the front line. We are the first person that come in contact with patients. So you begin to put the life of your your health practitioner at risk, which is totally unfair to the health workers. So you want to consider that when you panic buy, when you're buying surgical masks for no reason. There is no need to buy surgical mask if you're not sick. And to be honest, since we're all in quarantine, you're staying in your house, there'll be no need to use the surgical mask. If you're not sick and you don't need to use a surgical mask really, because it's preventing you from infecting the next person. What are the symptoms of coronavirus? Symptoms of coronavirus ranges from fever, dry cough, shortness of breath, sputum production, muscle pain, joint pains, nausea, vomiting, diarrhea. If you have any, and I said that in the form of severity, if you have any of those symptoms, please call the NCDC. And you have any travel history or contact with any confirmed cases, please you can call the NCDC. Please do not leave your medical history when going into any hospital. It is very important that you are responsible and give the right information. Protect the health workers, protect everyone around you. It is only fair that you do the right thing as a Nigerian, and we expect that everyone be responsible citizens. Also, the incubation period has been said to be about 1 to 2 weeks. Hence, the reason why they instruct everybody that come back to stay indoors for 14 days, expecting that at least some symptoms of this disease will have shown. And if you need any care, you will call the NCDC. Please do not present to the hospital without calling the Nigeria Center for Disease Control. It is not right. It is criminal to put the life of the health ones at risk. It's totally criminal. If you have symptoms, call the NCDC. They will come in the right way, take some detailed history, and if you require some testing, they will do that. And if you require urgent medical attention, they will make sure you move to the hospital for adequate care. Please do not come to the hospital and put people at risk. It is totally unfair. So I'm sure we've seen every documentation on how to avoid wash your hands, cough into your elbow, use sanitizer, avoid touching surfaces, avoid touching the rails while climbing the stairs, and um so many health advice. Please check the World Health Organization and the Nigeria Center for Disease Control for proper information. Do not be carried away by people who are bringing up theories that are not founded. Also, I know that there's been a lot of conspiracy theory on how this started and all that. I feel like we should be focused on how to flatten the curve. That is the goal here. Currently, there is the coronavirus in Nigeria. The goal is to flatten the curve and to eliminate it. Please, this is not a time to sit down and think about the conspiracy theory and argue that throughout the day. This is the right time to pass the right information that can help you and that can help you and keep your family safe. Please, let's focus on what is important. To know that there is currently no vaccine for coronavirus. However, a lot of work is being done on it, and once it's available, I'll let you know. I'm sure we'll also get to know from the World Health Organization, from Nigeria Center for Disease Control also. Also, for now, the main treatment is just supportive treatments. So we try not to worsen the cause of the disease. So just supportive treatment. So basically what supportive treatment is, if the patient is dehydrated, we give IV fluids for rehydration. If the patient has fever, we can give antipyretics. If the patient has pain, then give something to relieve the pain. So basically it's a symptomatic treatment. If they cannot breathe, we can put them on ventilators and help them to breathe. So basically it's just a symptomatic treatment. And it was advocating for ventilators so that we can put our patients on ventilators and they can do better and be distracted. This would be something we're going to talk about in the future. I'm sure we're going to win over this situation. So keep being positive, share only positivity, and do not agitate people. Share the right information. Thank you very much. I forgot to add that there's something called asymptomatic carriers. So there are people that who do not have the symptoms, but they are carriers of these diseases. Which is said that asymptomatic carriers can infect too. So someone who doesn't have the symptoms does not look like he has the symptoms, but can infect someone, and it can actually have a more like the other person might actually be more sick than the person who gave the person, if the person has other comorbidities or just generally the person can be more sick. So you want to stay in your house. You don't know who has it because you don't know everybody's travel history. So just generally be careful. You're not only supposed to avoid people that have cough and catarrh. There are some asymptomatic carriers. So I just wanted to put that out there since I forgot to add that in the video. Please stay safe. Thank you. Please like, share, subscribe, and drop your comment. Let's get the conversation started below. Thank you.